where we are speaking about the third Red Sea Ophthalmology Symposium. Joining us here in the program via the direct telephone line is Dr. Mohammed Gogandy, who is a consultant ophthalmologist. Assalamu alaikum, and a very good morning, Dr. Mohammed.
Wa alaikum assalam wa rahmatullah, and good morning to everybody.
So, Dr. Mohammed, today as we are focusing on the third Red Sea Ophthalmology Symposium, tell us more about it.
Ophthalmology Symposium held in Jeddah is the third being held. The first one started in 2015, and this year was the third one. The symposium usually focus on the newest things that happens in the field of ophthalmology. Ophthalmology, for everybody to know, is the field that takes care and deals with the human eye, dealing with its histology, pathology, and optics. So ophthalmology is the eye medicine, let's say. So ophthalmologists are the eye doctors, for short.
Indeed.
Indeed, doctor. And I mean, what was the reason for holding this symposium?
As everybody knows that the medical field is a fast evolving specialty for people who comes to our service or seeking our help. To give them the best medical service, every medical practitioners needs to be familiar with the latest updates, the latest technology in his field of practice. So holding such symposiums and events is a great way and one of the best ways to enhance the learning experience of medical practitioners. So the aim, in simple, is to keep doctors up to date so they can give the best service to our customers or patients, let's say.
Right. And Dr. Mohammed, as we are speaking about the symposium, which you said that in this time it is the third time for this symposium to be, tell us about some of the main subjects of discussions. What was the focus for this time's symposium?
So this year focused on many things. One of the most things focused on was cataract, the newest in the surgeries of cataract, the types of lenses we implant inside the eye. The focus was also on the laser vision correction, I mean refractive surgeries, getting people to get rid of their glasses. The updates on diabetes retinopathy, I mean the problems that happens in the retina secondary to diabetes. Also, the focus was also on a disease called prematurity, retinopathy of prematurity. It's basically a disease that affects babies who are born premature and disturbs their vision. So whenever we treat them early and give them the best treatment, usually we save their vision. Also, treatment of glaucoma, the latest in the treatment of glaucoma, the latest surgeries and the new techniques and the new drugs in the treatment, plus optics, dealing with patients with disturbed vision, myopia, hyperopia, astigmatism, and how we can help them with glasses or even contact lenses.
Wow. And I mean, doctor, like, what's the special thing about this year's symposium from the previous ones?
So in regard to what was special, I mean many things were special in this symposium. It was the biggest, actually. We hosted around 31 international speakers, more than 130 regional and local speakers. More than 80 scientific papers were discussed. Many workshops were held. Most of the manufacturing companies specialized in ophthalmology were there, displaying their latest technology in the field of ophthalmology. And a course was held by the American Academy of Ophthalmology, was held for 2 days. Another session was hosted mainly by European School of Advanced Science in Ophthalmology, was there. Another one was hosted by a society from Egypt, So it was like a multinational meeting. Plus, one main thing was held there. Many workshops were held simulating the real surgeries and how can we do it in a proper way. And that was mainly directed to the young ophthalmologists, the people who are currently in training before they start operating on normal human eyes. Usually we bring cadaver or sheeps or even artificial eyes. Then local international speakers were there teaching them how to do the procedure in the latest and the best way. So whenever they go home to their hospitals, they can practice and they can be familiar with the procedure. Plus, a non-social, a non-medical social meeting was held on one of the nights of the symposium, hosted different people who were really successful in life, yet they were handicapped. They had poor vision maybe since childhood, yet that didn't prevent them from being successful in life, and they shared their successful, inspiring stories to everybody. It was a really nice one.
That's certainly very good to be bringing about the positive vibes in that people, how it is that they have been able to succeed in their life and in their careers, even though they had, let's say, poor vision or very insignificant vision. But with this, Dr. Mohammed, let me just quickly ask you, we're talking about real surgeries. So are there any new, let's say, medical breakthroughs in the treatment of eye diseases which used to be surgical and are going to be a little bit non-invasive now, non-surgical now, or any major developments as such where we are going to have maybe a laser intervention or something for the treatment, let's say, of the diabetic eye or things as such?
Many of the treatments actually used to be surgical. One of the main treatments for, let's say, diabetic retinopathy was surgery, currently being laser, and now it's going to be more of like injections, just a few seconds injection inside the eye, and that's it. That also applied to the patients with the retinopathy of prematurity. The main treatment was used to be surgery, then it became laser, and now research is going on treating those babies using injections only. In glaucoma, the surgeries used to be like major surgeries, big incisions into the eyes. Now they're becoming less and less invasive, being done using laser only, or just minimal or minimally invasive surgeries, like just implanting a device that helps in controlling the glaucoma of that patient.
Wow. And that's really interesting, doctor. And I mean, you know, in our generation now, we always use the computer, the phones, and like literally we spend, let's say, 80% of our time of day in front of the screen. How can we like protect our eyes, especially if my work has to make me spend that long time in front of the screen, either computer or phone or whatever that can protect my eye?
Great. That's one of the common questions we usually get in the clinic. My works requires a lot of attention to my smartphone, my tablet, or my PC screen. So what can I do? At the end of the day, my eyes feels burning. I cannot open them. I feel a lot of headache. So what shall I do? So in simple, the eye has many muscles. So exerting the eye means you're exerting a lot of stress on your muscles. So what do you need to do? A few simple things. Whenever you're focusing on anything, a temporary dryness happens in your eyes. Like usually you should blink frequently whenever you're looking. So whenever you focus, you don't usually blink the normal frequency. So dryness happens at that time. So that's one thing. The other thing, focusing on one thing for like 1 hour that's a lot of stress on your eyes. So for like every hour, you need to take like 10 minutes break. You need to do something that does not require using your eyes, either looking at faraway objects or maybe closing your eyes. That helps a lot. After that, you can go back to your work, and hopefully that can help. The other thing, usually whenever we're holding a smartphone or a device, usually our neck is bent down. So again, that's a lot of stress on your neck. So whenever you're doing something it requires attention a long time, make sure that you're sitting in a comfortable position. Plus, since our kids, our brothers are having their exams these days, a word of advice that please don't stay up studying. That doesn't help. Even it puts a lot of stress in your eyes. So having blurry vision at night, red eyes, having a lot of tears during your studies, because the eye is already exerted. So please don't stay up at night. That doesn't help. Just have a good sleep. And that, again, that helps a lot during study.
Yeah, but I mean, doctor, you know, sometimes some international companies, they start to sell these screen protectors, or they sell glasses that you can wear that they say will protect your eyes for long-term, you know, computer use or phone use. Do they really protect us, or are they just fake commercials?
Actually, I didn't come across anything that supports such a thing, protecting your eyes through like reflectors or like screen thing. I didn't come across anything like
in the medical literature, you mean?
Come again?
You mean like any kind of a scientific or medical evidence about it, doctor?
Yeah, that's what I mean.
Indeed. It's really amazing how commercialism is taking over us, and then, you know, for the people who have innocent minds who do not know as much about such things, they feel like, let me spend my money and let me, you know, have better vision over the period of time while I'm using my gadget or my smart pads 24/7. But anyways, with this, we would like to thank you so much, Dr. Mohammed Gogandy, for joining us in today's edition of the program. It was a pleasure having you with us.
Thank you. Thank you very much for having me.